Welcome to the CEN show, where we present the voice of the community. The CommunityEducationNetwork.com is a platform to aid the effort of self and collective improvement. In your investigative or spare time, visit the website and participate by joining the forum to express your thoughts with the community. I am your host, Rasaki Maskani. Tonight's topic is community health. Tonight's guest is Sandra Rogers. Sandra Rogers works in the field of health, and I am eager to hear her expertise point of view. Good evening, Ms. Rogers. How are you? And please share some things about yourself.
Good evening. Well, two of the people on this podcast know who I am very well. But for those who don't, my name is Sandra Rogers. I work for LA County Department of Public Health. I'm a supervisor, public health investigator. I've been doing that for about 31 years. I work in the community of Spot 6, which is Compton, Watts, Willowbrook, Paramount, some parts of Carson. It's pretty big district. So that's what I cover. I've always worked in communities with high disparities because that's what where I want to be. And I also, in 1994, I started a support group for HIV positive women, African-American women who were HIV positive in 1994. I was given the opportunity to start a group for African-American women. And unbeknownst to me, it was the first African-American support group for Black women in Los Angeles. So that was a good thing. So that was great. I did that for about 17 years. After that, I had a support group for long-term survivors, HIV positive women, long-term survivors that I still do. We just haven't met in a long time, and then with COVID. But I'm still very associated and into HIV positive Black women and women of color. And so that's me. I'm a product of my community. I was born right on 74th and Avalon, right by Fremont High School, if anybody knows the area. And I've worked in my community for the past 31 years. So, and I'm very happy to be here. I'm gonna you'll see me reading a couple things off of some papers. I hope that doesn't distract anyone, but it's just some things I wrote down that I want to make sure I said. So I'm happy to be here. Lisa Kelly, who Peter knows very well, and Diane has met a couple times. She is the one who told Rigo about me. And I'm glad he reached out, and I'm glad to share whatever experiences I can.
Okay, well, I appreciate you coming, and hey, we're gonna do it like how we do it. You could read and do what you want to do. Just we're eager to get this information out here.
Okay.
I'm gonna go ahead and start.
Now, Rigo, is Almond Rod gonna be on?
He's supposed to be coming, yes.
Okay.
And Rasaki Maskani.
Okay.
That's the name we use here, but that's fine.
Rashaki. Okay.
Yeah. So what we can go ahead and get started.
Okay.
With the questions here. Okay. So we have had a few conversations about some of your experiences as it relates to your profession. One was about a home visit. Can you share one of those experiences?
Yeah. In fact, I want to share two of them because they're brief.
That's fine. Good.
So let me say what we do at my job. First of all, we deal with communicable diseases. Period. So if anyone has a STD, TB, or any other communicable disease, it could be Salmonella, Shigella. We are the people that follow up with those issues in the district in Spot 6. So if you go to the doctor, any doctor, you go to a doctor in Watts, you go to a doctor in Beverly Hills. If you have gonorrhea, chlamydia, syphilis, or HIV, it's going to be reported to the health department, point blank, period. And when it's reported to us, it's our job to make sure that you have the disease, you're treated for the disease, and your sex partner is treated for the disease as well. That's the goal. If you're not treated for the disease, we will get you treated for free. And they would come to our clinic and get treated for free, and their partners as well. We also do HIV testing. So we tell people they're HIV positive. We refer to HIV doctors and things like that. So when it comes to working in the field and home visits, if you get a call or you get information from of a person that you have to follow up, you can call them and try to catch them on the phone. Some people don't have phones. Some people's phones are off. Some people's phones aren't working. So if you don't get them on the phone, you have to go to their home. And that's where the home visit comes in. So we go out to the home, knock on the door. Hopefully the person we're looking for comes to the door. If they don't, we ask for that person. We can't give any information on that person. Anybody who is age 12 and up, if you have an STD, the health department does not have to tell your parent, your uncle, your grandmother, anything. It's all confidential. Okay. So when we get to the house and we ask for the person, we let them know that this is confidential information. We verify their name, their date of birth, ask them, did they go to Kaiser or wherever? If they say, yes, I did, we ask them then, do you know that you had an STD? And they may say, yeah, I knew that. And we'll say, oh, cool. Did you get treated? And they may say yes or no. And then we move forward. So, and then also we work with tuberculosis. So if a nurse is having a patient who needs to come in for a chest x-ray and doctor evaluation, and that person is quote unquote non-compliant, whatever that means, they refer to us. And then we follow up with that client to find out why they're being non-compliant, and then we try to get them in for doctor evaluation. Same thing. So the two incidents I'm gonna talk about is what I personally experienced in my 30 years of working. These two things stand out. And the first case was a TB case. And I had a new employee. It was her first TB case. So anytime you have a new person, you always go out with them. You accompany them in the field. So we went out. This was a woman who had tuberculosis, but she was also HIV positive. And the nurse had already told us that the woman was very sick. She wouldn't come into the doctor, and they needed us to help her get in. So when we get to the house, we go in, and yes, we do go into the houses. We try not to go in as much as we used to, but we were trained to, that's part of the job. So we went into the house, and the woman was in the bed, and there were people around her bed, and they were praying. And so her sister, she comes and asks us, well, why are we here? And we said, well, we're here because, she has tuberculosis and she needs to come to the doctor. And, for whatever reason, she's been non-compliant. Now, in my head, I'm thinking, okay, well, she's in the bed and people are praying over her. So that could be a good reason that she didn't come into the doctor to get checked. So while we are talking to the sister, a woman comes in the room and tells the sister that this woman, that the client that we're looking for, just died. So we're at the house. This woman has just died, and it's chaos. It's chaos. So one thing that I try to teach people that work with me is you have to meet people where they are in any situations that they're in. So the sister came to me and she was crying and everybody was crying. And so, we ended up staying there for maybe 20 more minutes, just trying to console and because it was just a mess, the person, of course, the new person I was with was like in a state of awe because she's like, well, first of all, no one's ever died on her and she's never been in a stranger's house where somebody died. So I was trying to keep her in a place where she could understand that this can't happen, and this can't happen in the field. It just depends on the case. It depends on the issue or what's going on. So that was a good lesson for her, and she talks about that to this day. That the compassion that was shown, even in the midst of this trauma, and grief was something that, as far as the health department goes, we need to represent. The second incident that I remembered was I was looking for a woman who had syphilis and went to the house and the door was open, you know. So I stand at the door, I'm like, hello, 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 you know. So you hear somebody say, yeah, what? Come in, what's up? So I sat in, and in the living room, Peter, I don't even know if I told my husband this, because you know, he's scared for me in the field, you know, So I walked in the room and there was like a group of bloods in the room, you know, red everywhere. Red everywhere, blunts, 40 ounces, the whole nine. So, but you know, this is something that we're taught. So the thing about it is, if you're fearing or if you're worried about it, really, well, you don't need to do the job. But so it goes like this. So I walk in and I see, okay. So I stand in the door. I don't go all the way in. I stand in where I'm at and I say, hey, I'm looking for so-and-so. Do you know this person? The guy's like, yeah, we know her. And, you know, I'm like, okay. I said, well, is she here? No, she's not here. I said, okay, well, can I leave a letter for her? Will you see her? They're like, yeah, you could do that. You could do that. It's cool, you know. And of course they were like, well, who are you? You know, and I said, well, you know, my name is Sandra. I'm with the health department. You know, I'm not LAPD. I'm not nobody, no detective. Really, I'm here because I'm concerned about her health. And that's one thing that I've learned working in areas like South LA or Watts or you know, Inglewood and things like that. One thing I've learned is you got to meet people where they are. You can't be fearful of people just because, you know, if they're representing something or if they're angry, if they don't think like you, it's whatever. It's like, look, we're here to do the job. And what's interesting that I've learned in my years is that once people know that you're with the health department and then you're really, really there at their house trying to help them, trying to educate them, trying to get them medication that they need, a mental health person, gang member, you know, who an educated person, whatever, it doesn't matter. Most of the time they appreciate that. And they open up and they are willing to share information. So those are two stories that I can share.
Okay, I was kind of.
There's a lot more. There's a lot more, but I mean, it's 30 years of work, so there's a lot more. But those two things really, you know, those stick in my mind.
Okay, well, that was interesting. Now, when you do go to the door, I was wondering, do you immediately identify yourself, or it's whenever it's necessary?
Immediately, you know, everybody has their own way of doing it. I immediately identify myself. You know, a lot of times we're trained not to even say we're with the health department, but I've learned that doesn't work. If you walk into a house and say, hi, I'm looking for Diane Moore, and Diane's mother says, well, who are you? And I say, oh, I'm Sandra. That really doesn't fly. It really doesn't fly in the Black community.
Okay.
People want to know who's at their door, why are you at their door, and why are you asking for somebody in their household? So usually I just let them know, hey, listen, I'm with the LA County Department of Public Health. I'm just looking for this person because I need to talk to them about a matter that's important. And when I say that, I usually get a positive feedback.
Okay.
Usually accommodate me when I just break it down and let them know what it is. I think they get a little bit more aggressive when it's like you're playing a game. You know, I'm looking for Diane. Well, who are you? I'm Sandra. Well, who are you? I'm Sandra. Yeah.
Okay.
So that usually doesn't really work for me.
Yeah.
So once I just identify who I really am and what it's about, and it works that way. And even I must say in the Latino population too, because my community is Black and brown. The moment somebody comes to the door that it looks authoritative, you know what I mean? They get defensive because, you have people who are illegal, and you have people who are on guard about things. So once you let them know what you're there for, why you're there, it kind of eases attention, and they're prone to cooperate with you more.
Yeah, I think that's good because you should know your community, and if you know it, that'll make things a little bit better
Right.
when you have to deal
Right.
with them. Okay, Diane had her hand raised. Diane, you had a question?
Yes, I have a question for Sandra. In your first story, you did indicate that you do work with juveniles and minors as young as the age of 12 when it comes to sexually transmitted diseases. And so I was wondering, are those minors provided with social services or mental health or wraparound services? Are they provided for them? I know they're sexually active. They may have caught an STD in some way. With their age being so young, I was just wondering, are there wraparound services in addition to the services that they're receiving from the public health department?
It depends on if they come in and see the doctor and the doctor feels that there is something else going on bigger than what my team deals with. Then she may do some type of referrals. Honestly, if you're 12 years old and you come into the clinic with gonorrhea, you're going to get treated for that gonorrhea and you're going to be sent home.
Wow. Okay.
If you're under the age of 12, then nursing will get involved and they will call the police and take it that route, because under 10, 11, 9, 8, if you're coming in with gonorrhea or chlamydia or syphilis or HIV, that's considered where they could get more people involved and find out what actually is going on. But unfortunately, 12 and up, you can come in. I had a young girl who came in, she was 13, really, really pretty girl, 13 years old. And in fact, it was interesting because her mother brought her in. So she had gonorrhea, she had chlamydia, and she had syphilis. And so I interviewed her and I said, well, you're 13, you have 3 STDs at one time. So that's an issue. Talked to her about her sex partners. There were more than 3. And they were boys in school, at her school or on her block. She said her mother was aware of the boys and her mother was aware of the STDs. What her mother wasn't aware of was that she was also pregnant. And at 13 years old, if the mother had come in the room and said, hey, Miss Rogers, what's going on with my daughter today? I know she has gonorrhea. I know she has chlamydia. I know she has syphilis. So are you going to treat her? What's going on? And I'll say, oh yeah, we'll treat her. But it is against the law for me to say, oh, but did you know she was pregnant? So I can't even tell the mother that she's pregnant.
Wow.
Yeah, which causes a lot of parents to pause with that. If you go to a house of a 13, 14, 15, 16, 17-year-old, I have a 23-year-old right now. If they came to my house, I probably know what it's about if they say to the health department, but I still be like, wait a minute, hold up, what the hell? So imagine a parent answering the door for the health department for their 15 or 16-year-old kid, and it's like, what you mean you can't tell me why you're here? You do have some parents who will have a major problem with that. But also it's interesting, you will have parents, I've seen a lot of parents who you tell them, well, I'm here with the health department and I'm looking for your kid. And the parents say, oh, well, he ain't here right now. You want to leave a letter, leave a letter. And that's that. So sometimes it makes sense sometimes why you have a lot of young people who act out and do certain things when you see where they come from and see that, you know, people are very nonchalant about their lifestyle at 12 and 13 and 14 years old. You know, so, and one thing I want to say too is the young lady, the 13-year-old, I talked to her a long time because she was 13, had 3 STDs and was pregnant. So, and I asked her, you know, well, what's going on? You know, why do you want to have sex with these different people, these different guys? And she told me, she says, well, you know, the only time I hear somebody tell me that they love me is when they're on top of me.
Mm.
And I got it. Some people may not have gotten it, but I got it. I got it. And that just goes into, and we'll talk more too about the disparities and things like that, but that just goes into the conversation about the disparities and the things that, you know, people in certain communities go through.
Thank you. Thank you.
You're welcome, Di.
Okay.
Good question though, the wraparound services.
Okay, so now my next question was related to the STDs and HIV. You kind of touched on the STDs. Can you talk more about how your job relates to HIV?
Yes. Well, for HIV, what we do is there are people that come into our clinic. We have a free clinic at our job. So we have a clinic where people would come in, they could get tested and treated for gonorrhea, chlamydia, syphilis, they get HIV tested, and it's free. And I work at MLK, Center for Public Health, on 102nd in Wilmington. That's where I'm at. Okay. So it's all free. And when they come in to get tested, we offer HIV testing. And when they come back for their results, if the results are positive, we're the ones who tell them that they're positive. We're the ones who give them their results and let them know your HIV test came back positive. And what we do with that is we meet them where they are. We take time with them because we don't know. When you tell somebody they're HIV positive, you don't know what you're going to get. So I've had people who fainted. I've had people who cried. I had people who got up and left. I had people who looked at me and said, okay, all right. So what do I do now? So you just, you know, you tell them they're positive and you be quiet and you let them respond to that. And whatever the response is, then you act on it. So if they faint, you call the doctor and the doctor will wake them up or give them some smelling salts. And, you know, if they cry, you let them cry. As long as it takes. They want to cry for an hour, you cry for an hour. Somebody's knocking on the door saying, hey, Sandra, we need the room. Well, you ain't gonna get the room because this person's falling out because HIV positive. So, you know, it all depends. And then what I do for my staff, what we don't have to, but we have an HIV clinic. I mean, it's in walking distance, it's right next door to our building. So what I do is I have my staff walk them over to the HIV doctor. And then we also follow up with our clients for 3 months to make sure they're doing okay, make sure they like the doctor, make sure they're getting referrals they need, make sure they have support and things like that. That is something that we don't have to do, but that's something that I do and I have my staff do because I have a passion for HIV positive clients, and my staff does as well. And so that's why we do that type of follow-up. So, and as far as the HIV support group, I just want to say that the numbers of HIV in women are extremely high. They're higher than white women, they're higher than Latino women, they're way higher than Asian women. African-American, the newly diagnosed people are mostly African-American women, which is alarming, but it's been that way for a long time. So especially women, I have a, you know, just a soft heart for everybody I do, but for women, I just want to just make sure they're okay and make sure they have some type of support. And that's what I do. So, yeah.
Okay.
You have-
So how you doing, Miss Lisa? You have to unmute.
Okay. Hi, y'all.
Hi.
Hey,
Hey, y'all. So, Sandra, I had a question too. So, what is the follow-up though when it comes to once an HIV person has been identified? You said that obviously you're there as a support staff for that person, but what do you do next? I mean, like, are they required to provide who they've been with, or do you put together a list, or is there a follow-up from the county in regard to that, or how does that work?
yeah, we don't ask them at that time, but we do follow up with sex partners to find out who they're having sex with, and let them know the importance of making sure their sex partners are HIV tested. So yes, we do that just like we do with any other STD. We do that.
Now, is there reluctance, or I mean, how, when you're
Oh, yeah.
having verbiage back
Oh,
and
yeah.
forth?
Oh yeah. Here's another story. So there's this guy that I tell him he's HIV positive, and his girlfriend is sitting in the waiting room. Now, mind you, remember I told you about confidentiality. So I can't tell his girlfriend that I just told him he has HIV. So what I did was I told him, I said, well, do you want to call her in the room with us? Because he can tell her that he's HIV positive, and then I can mediate. I could tell her, oh, it'll be, it's okay, that we're going to get you tested. We want to get you checked out, or whatever emotion she has, we could deal with it. So he says, no, I'll tell her. And so I said, okay. I said, well, today is Monday. I'm going to give you till Friday, and I'm going to call you. And if you haven't told her, I'm going to tell her. Now, the thing about it is, I can't tell her who it is, but I can tell her that she has come in contact with someone who's HIV positive. Okay. So I can do that. And that doesn't break confidentiality. Now, if she's only having sex with him, well, then she may figure out it's him. But that's how that goes. Okay. So anyway, he leaves the room, and I tell him, okay, well, you're gonna let her know. Oh yeah, I'm gonna tell her. So I, open the door, and he walks out, and she gets up and she says, hey babe, you okay? And he says, yeah, I'm okay. She told me I have hepatitis.
Oh.
So I was like, okay, all right, okay. So Friday comes and he calls and he lets me know, hey, I couldn't tell her. So Miss Rogers, yeah, I need you to tell her. I thought I could tell her, but I can't tell her. So I said, okay. I said, well, I'll make the call or visit her or whatever, but I'll let her know. And so he says, okay, can you call the other people for me too? And I said, sure. Give me their names, give me their numbers. I don't have any problem calling. I said, how many people do you have? He said, 7. I said, okay. I said, I'll call them. All 7 were men. So, and here we go. So the woman he brought in, the woman that he lives with, she was at risk, but there was also 7 other people who were men, that
Wow.
he didn't know about.
Wow.
Yeah, but Lisa, to answer that question, yes, we do follow up with the partners. And we follow up with any issues that they have, any concerns they have. And the responses vary. Some are easy breezy, some are very difficult. I remember there was this one young man that we gave HIV positive results to. He was about 20. And he got up and walked out. And I'm like, hey, wait a minute. I'm not done with my whole spiel. We got to get you to the doctor. We got to get, you got to see somebody. You need help. He walked out. I mean, I couldn't stop him. I mean, gone. So maybe I kept trying to call him. So maybe about 2 weeks later, he shows back up and he says, I apologize for leaving, but I just couldn't handle it. And I had to go to my girlfriend and I had to tell her because she's 8 months pregnant. So I'm like, okay. I said, well, you told her. So let's work on her and work on the baby because, we don't want the baby to have HIV. Anyway, long story short, we got her into care, but we got her in a little bit too late. So she was HIV positive, baby was HIV positive. But those are things that those are surprises that can happen, And like I said, when it comes to HIV and telling people they have a disease like that, and remember, when I started this game, HIV was relatively, you have it, you live maybe 6 months to a year, and then you die. When I started the support group for HIV positive Black women, it was in 1994. And the casket was in the room. I mean, it was basically a support group for women to get together, to cry, to talk it out, to, die with some type of dignity, or die with people around, other women around them, to show compassion. Because a lot of these women, their families didn't even know they were positive. Because the families wouldn't be able to handle it. I had one woman tell her mother, and her mother was like, "Oh, she can't stay here. She can't stay here." And I'm like, "Where's she gonna go? I don't know, but she can't stay here. I mean, I'm gonna have to sterilize. I can't sterilize all these glasses, and I gotta get I have to get paper cups. I have to get, like, ma'am, you can't get HIV by drinking after somebody or eating after somebody. No, oh no, she can't stay here." So it's really in those, it was really devastating. Like I said, the casket was in the room. We were going to funeral after funeral. It was just a support group for women to get together and sit and talk about how messed up their lives are, and why they trusted this person, why they married this person, because a lot of people think that, especially back then when women had HIV, it's like, oh, what was she doing? Well, the Bible says you can't be having sex with everybody and every brother out there. Well, there were women who got married, did the whole thing, and they got HIV. So, the stigma of HIV, which is still a strong stigma, but back then it was really off the chain. You were promiscuous. You must have been out there hooking. You must have been on Figueroa. You must have been shooting drugs. It was that type of stuff. And the interesting part of the women in my support group they were all educated Black women. One was a forensic chemist for the sheriff department. One was a doctor. One was an attorney. One sang background for Luther Vandross. I mean, so all the things that people think, all the Black women with HIV, they have to look this way. They're ignorant. They're uneducated. It's just, they broke every myth in the book, So so that's why I got the passion for HIV. And even now, when HIV is quote unquote manageable, they've made it manageable, with the medications, there's still people dying. And the rates of HIV women, Black women getting HIV is still high. It's still high. So.
Wow, that's interesting and unfortunate. That's all I can say about that. Okay, so can you discuss the distrust of the health department that citizens may have?
Yeah. Yeah. The health department in the Black community, or in the community where I work, a lot of people look at the health department, it's a government entity, which it is. And, a lot of people don't trust the government. Historically, Black people have had reason not to trust the government. And I was reading where was it at? Oh yeah, this is what I wanted to share. They were saying that historically, they were saying dead Black bodies was robbed from their graves, and they were a continuous source of surgical and anatomical experimentation. So, and then they even said that there was a diagnosis called the runaway slave syndrome, which, was saying that Africans who fled their slave owners. You know, it was considered a disease to flee. You know, and then everybody knows about the Tuskegee study. So I guess we don't have to go into that. That's what everybody, even young people who come into the clinic, you know, and they don't want an HIV test, or they want something like, no, because you guys gonna do the Tuskegee on me, you know. So that's like the common thing. And Henrietta Lack, those things. Even in mental health, I was reading where it says, Black Americans with mental health diagnosis are less likely to receive certain medications for their condition compared to whites with the same condition, you know. And also, I remember last year I went to an HIV conference in Atlanta, and there was a woman there who said that she was at home and she had started having chest pains and trouble breathing. So she, you know, she calls 911. The paramedics come, and you know, they're like, "Well, what's going on?" She's like, "Well, I'm having chest pains. I think I'm having a heart attack." And the paramedics are like, "Okay, you know." And she said, "They're just moving slow. They were just moving slow. No, there was no urgency." And she's like, I can't breathe. I'm having trouble breathing." So, you know, they get her in the ambulance. They get to the hospital. The nurse comes. You know, what's going on? I think I'm having a heart attack. You know, and she hears the nurse say, she ain't having no heart attack. Is she talking? She breathing. She's talking about she can't breathe. She talking. So lo and behold, you know, after a while, they diagnosed, she had a heart attack, you know, but it's just the thinking of the medical society that Black people can tolerate more pain than other people. Even Serena Williams. I'm like, Serena Williams is the GOAT. I mean, you know, she's everything in tennis. And when she's having her baby, she's having trouble breathing. She's telling people, "Hey, I need a CAT scan. Something's wrong. I need this." "Okay, we're gonna get to you. We'll get to you." "No, I'm telling you what I need. And then finally, you know, they find out she got clots in her lungs. And she's been telling them that she can't breathe. She's having trouble. You know, so, I mean, if you are going to look at Serena Williams like, okay, yeah, well, then you're going to look like Serena Martin. She really, you know, is not going to get the care. So it's true. I think the medical society feels, you know, that Black people can tolerate more pain. I know one lady was saying she was in pain, and they said, "Well, what's your pain level?" She said, "It's a 10, it's a 12. And, you know, later on, she looks at the paper and the nurse wrote 7 because, you know, they're exaggerating. We exaggerate, you know, Black people are overdramatic. We're, you know, our pain level is not that bad. You know, and besides, you know, Black people have tolerated pain for so long, they know how to handle pain. They're strong people. They know how to deal with it, you know. So, yeah, the mistrust for the government, for the health department, I totally get it. And I feel it's valid. Even I've had doctors. I had a Black doctor who gave me one diagnosis, and I knew the diagnosis, and she retired, and then I had the Asian doctor tell me, "No, that's not, no, you don't, you good. You don't," I'm like, "What the hell? The doctor already told me that, you know, I could do this, or no." You know, so, but with all that being said, and knowing that as a Black woman, as a Black person that works in the Black community, I think it's important to have people like me and my staff and people who work there at MLK who get it and understand and have more compassion and more patience for people and believe them the first time when they say that something's wrong, you know? So I think that's a start. And that's where everybody needs to start, with dropping the non-judgmental attitude or the judgmental attitude, hearing and believing what people say when they say it, understanding that people, all Black people or all minorities aren't stupid just because they don't have an MD behind their name, or a PhD or a master's. It doesn't matter. If somebody's in pain and somebody's struggling and somebody needs help, the compassion should be there. They shouldn't be just, pushed off, ignored. And it's ridiculous, but it's really scary to know that that's what people think about people in healthcare. In healthcare, we grew up thinking doctors and nurses were supposed to be the ones to care about us and take care of us. When, you have doctors and nurses saying, oh, well, no, you're okay. You're still talking. So you're breathing. You're not having a heart attack. And I remember with George Floyd, I think the cop told him, man, you could breathe, you talking. So the distrust for the health department is warranted. I get it. I try not to debate about it. I just try to educate it, and I try to hear what people say. I remember I was at this health fair, and there was this a lady, and she was in the booth next to us, and we were doing HIV testing in the swab in the cheek. And she straight up said, you guys better stop letting the health department put that in your mouth. They're giving you HIV. And some people listened to her and said, oh no, we don't want it. And then some people, went on and took the test. But and she was a very educated woman, but that was her belief. So a lot more community education needs to be dealt with, and a lot more compassion and understanding that the history that we've had as Black people and how we've been treated, especially in terms of health, well, everybody's not going to be embracing the health department when we come to their house or when we try to help them. So it's our job to say, hey, we get it, but we're still here. We still want to help, and try to gain their trust.
Okay. I think Lisa had a question.
Yeah.
Just to piggyback on what you were saying is, I would say even on a personal level, my mother, she's 78 years old, came from, a part of, our society or whatever, where they really didn't trust the doctors or anything. And so it's really hard as she's getting older that she trusts the word of her doctor, and so part of my job was to try to make sure she had a doctor that I thought was compassionate. So my question to you is in regard to, say, some of the seniors in our community or in your community. I don't know about my community because I don't know what's going on in our community. I can only represent my mother, but I'm just saying, based on your, interaction with a lot of the senior citizens, are you finding that they are more inclined to listen to, people that look like them, that are in the community trying to help them, or what kind of feedback do you get?
Yeah, totally. I feel the seniors that come into the clinic for whatever reason, right now we have a lot of seniors coming in for the vaccine. And if you look like them and you're talking to them with respect, because, seniors, you're going to have to show some dignity and some respect. And when you do that, they appreciate it. They're more open to talk about things. They're more open to having questions. You have to understand that a lot of seniors don't have access to a lot of things. A lot of things with the health department, we tell them, well, you want the vaccine, go online, go to this link, log on here. First of all, you have seniors, some of them don't even have computers. Then you may have seniors who don't know how, the link ain't working, and they're impatient because the link is not working. It's supposed to work, and they may come into the building a little attitude with kind of funky, like they're frustrated, and just acknowledging, hey, saying, let me walk you through it, let me help you. Yeah, it does. Seniors really appreciate meeting them where they are, and just understanding that they need help and you're there to help them. So yeah, Lisa, it's hard you know, when you have older parents and people that need help and they feel like they're not getting it. You know what I mean?
That's why I think your job is so darn important. It's very, very important because you don't know how many lives it is that you're touching. And I mean, I just know the struggle that I have in helping her. So
Yeah.
knowing that there would be a community-based program that's helping out our senior citizens to me is quite important. So thanks for that.
Okay.
Okay. So now, can you talk about some of those disparities in our community?
Yeah. One, before I go there, I just want to read one other thing about the mistrust of the community.
Okay.
You guys probably know this, but I just like to say, put it out there. One study of an emergency room records indicate that Black patients are more likely than whites to receive lower triage scores for the same complaints, meaning the triage personnel rate the complaints as less serious. As a result, less serious complaints in emergency rooms translates into longer wait times. And I be thinking about that because I'm like, when I go to the emergency room, I'm like, why are we here for hours? You know, and you wonder, and that makes so much sense to me. And then another thing said, physicians spend less time with Black patients when compared to white, and are less likely to perceive the patient as being honest regarding their symptoms. So that just basically goes back to Serena Williams and the lady I told you who was having a heart attack, but she wasn't.
Wow.
Yeah. So, and as far as disparities, well, okay. Like I said, all 30 years of my career has been in South LA. It's always been in areas with high morbidity. And high morbidity just means, I'm just gonna put it out there, high morbidity areas mean Black and brown communities. So when the health department has these screens and these numbers saying, oh, high morbidity areas, well, it's usually Black and brown areas, you know. And the disparities are, it's just a lot of brokenness, I find. People are broken where I work. There are people who are in despair. There are people who the unemployment is off the chain. The gang violence is off the chain. Teen pregnancy is off the chain. Black men not being in the home, the fathers are not in homes. You have a lot of Black mothers raising their kids. Not to say that there aren't Black fathers in South LA, Watts and everything that are in the home, but the numbers are higher of single parents. That's just what it is. Suicide is higher. Mental health is higher. So you have all of these disparities that you have to try to navigate through. So for example, if I'm dealing with someone who has gonorrhea and I'm going to their house, but I see that they not only have gonorrhea, but they're 16 years old and they're looking after their 4-year-old, 5-year-old, 6-year-old, 7-year-old sisters and brothers, and there's no food in the house, and the mom is working 3 jobs, so she ain't gonna be home. You know, it goes on, and now it's a whole nother level. It's a whole nother level. And you have to figure out how to address the gonorrhea and the treatment and the sex partners. But then before they leave, you need to figure out, okay, what kind of referrals and what can we do to get them some assistance and get them help, you know? And that's the whole personal game for me. It's not just treating the disease, it's educating and treating the other issues or helping with the other issues that you see that are happening. And that's hard to do at times because people don't want to talk about their pain. People don't want to talk about their trauma. You know, we were talking today at work and I was like, you know, just watching the George Floyd murder from the time they come to his car, to the time they put him on the curb, to the time they put him in the car, to the time they put him on the ground, and then the 9 minutes of that. For just watching that, you know, it's a whole lot of people who are traumatized from that. It's trauma. And knowing that Black people are not respected, lives don't matter. You know, it's a lot. It's a lot of trauma. Yeah, you can talk about that too, Pete. There's a lot of trauma, but so the disparities are vast. The disparities are huge, and trying to figure out how to help people and heal people is major. It's major. Even food, even food. We have things called food deserts, where, you know, in certain communities you can't even get fresh apples. You can't even afford, you know, fruit. Thank God there's a woman who works for Drew. Her name is Dr. Cynthia Davis, and she has she goes around and she makes beds for people to grow their own fruits and vegetables. She brings the person in to grow, and she teaches people how to grow their own fruits and vegetables in their backyards, in their schools, and things like that. And sometimes that's the only way people gonna get fresh fruits and vegetables. You know, you just don't see that. I'm on a committee at Jordan High School in Watts. Jordan, it's on 103rd. And now I know you work at Centennial. Yeah. So I don't know if you see what I see, but the wellness program at Jordan High School, the senior class is supposed to have health to graduate. You can't graduate without your health class. Jordan High School didn't have a health teacher to teach the kids health. So myself and another outside group had to come in and do a curriculum to teach Jordan High School students health classes. Now, I bet you dollars and donuts, even at Dorsey and Crenshaw, they got a damn health teacher. And so I know at Hamilton and Pacific Palisades, they got a health teacher. But on 103rd by Grape Street, we can't get a health teacher to teach the senior class who needs help to graduate. Now, how much sense does that make?
That's terrible.
How much sense does that make?
Yeah.
You know?
Yeah.
Another issue with disparities and issues that I have with, issues I have with the health department is everything's about money. And that's fine, because, you know, businesses run on money. But the money is not evenly distributed to high disparity communities. So here's an example. In my community, Black girls ages 12 to 24 are teething with gonorrhea. I mean, gonorrhea is off the chart. You know, every Black girl that come into the clinic got gonorrhea. Now, chlamydia is the #1 disease, but the health department is not even focusing on chlamydia anymore because it's too much. And they don't want to put the money into it. But Black girls in the community, ages 12 to 24, are the rates of gonorrhea are off the chain. But the money is not going towards that. The money is going towards syphilis, which is fine. Pregnant women with syphilis, which is a big deal because, you know, we don't want babies being born, you know, with syphilis and dying from syphilis. So yes, that's a big deal. It's also going to gay communities, men having sex with men and things like that. Okay, that's where the money's going. But the money's not going towards the gonorrhea issue in the community. And I have a problem with that So what they're saying now is, well, what we used to do is if we have somebody with gonorrhea, we get them treated. And if they already been treated, we still ask about sex partners and we educate them. You know, you have to say, hey, listen, if you have sex with a guy and he gives you gonorrhea, if you get treated and he's not treated, when you have sex with him again, you're going to get gonorrhea again. And if you get treated and he doesn't get treated, then you're going to get gonorrhea again. It's a vicious circle. So let's stop the madness and let's get your little boyfriend in and get him treated. Okay. So that's the education we do. We also tell them the more and more you get gonorrhea and chlamydia, yeah, it's treatable, pill and a shot. But the more and more you get it, it affects your immune system. So God forbid the day you have sex with the boy who has HIV, you're going to get it just like that in comparison to somebody who's never had an STD before. So this is the education that we talk to these kids and we share. You know, we try to let them know. We let them know about infertility. Hey, you keep getting gonorrhea, you know, it can turn into pelvic inflammatory disease. You can end up in the hospital. Your future of having kids may be shot. Same thing with boys. You know, you keep getting gonorrhea, you keep getting this, you're gonna mess up, man, where you're gonna be shooting blanks for the rest of your life. You ain't gonna have no kids. So you educate people and you tell people that's our job. So now what they're saying for us to do is, Sandra, if the 13-year-old, 14-year-old, 15-year-old, 16, whatever, if they have gonorrhea and they're treated, you don't have to educate. Hell, you don't even have to tell, you don't even worry about the sex partners. Just close the case. And for me, that's something that I refuse to do. So where other departments are following the policy for that, if a person has gonorrhea and they're treated, you don't have to follow up. I tell my staff, oh no, you're gonna follow up. Point blank, period. I don't care what they say, we don't have to do, you have to do it. Because there's no way that I'm gonna have a 14, 15 teenager in our clinic with an STD, and just because they're treated, be like, okay, well, have a nice day. There's no way. They have to be educated. They have to be told about reinfection. They have to be told about the consequences of keep getting reinfected and what this can do to your body. I mean, it's crazy. But like I said, these are Black girls, ages 12 or 24. Now, if there were white girls, ages 12 or 24, in Palos Verdes, or on the west side, or somewhere else, I bet you dollars of donuts, it wouldn't be that way. And I'm always the angry Black woman in the room when it comes to being at the table. I've met with Dr. Ferrer. I've met with, Dr. Gunzenhauser, big people with the health department, saying, hey, this doesn't make any sense. Let me show you why it doesn't make any sense. You know, you guys really need to put the money where in the disparity communities. And, you know, you hear that they say, oh, we understand. We get it. We're working on it. We hear you, Sandra. We're working on it. I care about Black girls too. You know, I care about Black kids too. I'm going to work on it. And, you know, I haven't seen any work on it, and it's been a couple of years. So the only thing I can do right now for me is keep talking about it when I go to meetings. Keep letting the community and people know that this is what's going on. And, I call it passionate. They call it anger. But I call it passion, because I'm a Black girl. I'm a Black woman. I have Black girls. I have 2 daughters. I would hate my daughters to have gonorrhea, chlamydia, and if they've been treated, nobody's saying, oh, by the way, this can do damage to your body. Or, oh, if you have sex with a guy again, you're going to get it again. And, I mean, it's ridiculous to me. It's ridiculous to me. So, and even with Black boys, we have to tell our Black boys this. Black boys become sterile. Black boys can have these issues. So, that's my thing and what I'm into, and my fight, I guess I call it my fight, is to get this issue discussed and addressed. Because where's that paper? Show you.
Well, while you pulling that up, I'm glad that Lisa said what she said, that you are very important. And it's just it's amazing how things are. And it's good that we have people like you around, because
Well, thank you.
hopefully somebody's coming behind you that will take that mantle and keep it going, because we are in some serious
Yeah.
situations here.
Right.
Yeah.
Right.
Okay, so what was that graph?
This paper, I just want to show you guys, this is gonorrhea in LA County by age. So 12 to 24 is what's circled. So you guys get this. I just want to give you a visual. You guys really didn't need a visual, but you know, sometimes people like to see like, well, let me see what you're talking about. And this is gonorrhea in LA County by race. The females, the orange is females, the blue is males.
And that's who now? That's
Gonorrhea in LA County by race.
by race, and that's what's circled.
This African Americans.
Wow.
African Americans, I'm sorry, this is white, African American, Latino, Asian.
Wow.
Yeah.
Yes, very important to know, because we need to make some changes.
Right. And then what I want to say is the importance of gonorrhea. It's just these are two scenarios. A 12-year-old female was referred to PHI, that's us, for positive chlamydia follow-up. Per case investigation, patient disclosed to PHI that she had engaged in sexual relations with her father. This abuse had been ongoing from 2017 to May of 2018. If the PHI had not followed up and just administratively closed this case, DCFS would not have been notified. 15-year-old female, first sexual encounter, decided to get tested. She was referred to PHI, HIV positive, newly diagnosed. Patient engaged and disclosed to her HIV and disclosed her HIV positive results, as well as initiating her 17 and 19-year-old sex partners, both newly diagnosed with HIV. So this is just somebody who came in to get tested and had HIV, 15 years old, and had a 17 and 19-year-old partner. So this is the importance of following up. Another one is a 20-year-old female who was treated for gonorrhea at her college health center. If she hadn't followed up or we didn't follow up with her, she wouldn't have known she was also HIV positive. So she had gonorrhea in college, went to the local health center. You know how colleges have health centers. Went there, they treated for the gonorrhea, but we followed up with her, let her know she had HIV. And then we have a 15-year-old who was treated for gonorrhea. But if we hadn't followed up, he wouldn't have known that she had mental illness and was having sex with more than 10 men in 3 months. And of course, was reinfected with gonorrhea and had sex with an HIV positive person. So that's the importance of following up with these people. But like I said, if you're treated, the concern of following up is not a big deal. Okay, on to the next.
Okay, well, this is the last question.
Okay.
So what is your involvement with the COVID-19 pandemic, and what is your overall thoughts about it?
Okay, well, my personal involvement as far as work, we deal with work sites and places of worship that have outbreaks. That's what we do. That's my job. So if somebody's at McDonald's and 3 employees have COVID, that's an outbreak. If somebody's at church and 3 people at church have COVID, that's an outbreak. And we have to follow up with that. And the follow-up is, well, it depends what the follow-up is, but it's usually we have to do site visits. We make recommendations on how to keep people safe. We make sure that the people who are positive isolate. and don't come back to work or don't come back to church until the isolation is over. And so that is basically the job that I have. That's what we do in my department. It's work sites, places of worship. We don't deal with schools. We don't deal with skilled living facilities. We don't deal with any of convalescent homes, any of that. It's just work sites and places of worship. Now, my personal issue with COVID is I've known a lot of people with it, and I've known a good amount of people that died from it. And I have close friends who work in the hospitals and have shared with me the issues of watching people suffer with it. They say it's a very, very hard disease. People suffer, and it's something that you don't want. So, but I think after 500,000 plus, I think all of us can attest to the fact that we don't want it. You know, when the vaccine came out, I had a friend who works across the street at MLK, and you know, both he and I were like, "Oh no, we're not taking it. We're not. Let's wait." And so I was talking to his wife one day, and he said, "Oh yeah, Bruce took it." I said, "Oh." I said, "Well, let me call." So I called Bruce. "Hey, dog, I thought you wasn't gonna take it." He said, "Man, Sandra, let me tell you." He said, when they turned the chapel and the gift shop into rooms for beds because we was overflowing, and when the cold blue kept going on and on and on for hours, he said, but when I went into the waiting room and there was people just packed, you know, trying to get in to be seen. And this one Black woman fell out dead with COVID. He said, I went right to the back. I went to the doctor. I said, dog, hey, give me the shot. Give me the shot. You know, so, you know, there are people who don't want the vaccine, and that's okay. And there are people who do. For me personally, this is just me personally, the reason I changed my mind, because I was one of the ones who were like, I'm not sure. What is this going to look like? How is this going to affect me? But I did talk to a couple of doctors. But one doctor I talked to was a Black doctor that I trust, that I used to work with. And I just trust him. And it's another Black doctor, female, that I work with. And I trust him, you know. And what she told me was, first of all, my husband is a kidney transplant patient. And I donated my kidney to him a couple of years ago. Okay, it's a story, it's a thing to that. My point is. And so she told me, she says, well, and I have asthma. So, and I've had asthma since college. I've been out of college since 1987. So that tells you how long I've had it. So she was saying, you know, because you have asthma, your lungs are already, you know, not the greatest in the world compared to people who don't have asthma. And COVID attacks the lungs. And you would be the person that if you got COVID, you know, your story may not be, oh, well, I had it and I stayed home and I got over it, because your lungs are compromised, because you have, you know, you're working with one kidney. COVID may take you into another realm. You may be hospitalized. You may be on a vent. You know, it could happen. And the thing about COVID, it attacks the lungs, but you know, when your lungs are attacked and your lungs are compromised and you have then it starts affecting your other organs. Well, you know, if I only have one kidney to start, you know, I mean, if it affects that one kidney, then I would have complications. So, you know, that being said, I went on and took the shot. And for Peter, I mean, he can say his own thing, but he took the shot. He's immunocompromised. And I don't know, Peter, if you want to share any reason why you took the shot besides that. You're muted.
Yeah, well, you know, I took the shot because for a couple of things. One, I kind of do very similar on a different level with Sandra. I'm an environmental health and safety engineer, and I have to go to facilities. I go to businesses, I go to trucking companies, I go to plants, and I'm one of the people that has to help get them reopened. I have to sometimes go behind the health department to implement the recommendations that they come up with, because just because they come up with the recommendation doesn't mean they can necessarily implement it, and or implement it in a way that is going to be cost effective and allow them to keep business and keep people employed, especially people of color who are the people behind the scenes doing all the work. So for me to go into those facilities like that and then to come back with knowing what goes on with my family, especially, it was important for me to take the shot to protect the family. Like Sandra had mentioned before, and I just want to say this just to get this out there. Sandra had mentioned about we need to educate the community. And I'm just going to say it straight up. I'm sick and tired of the community having to be educated. Sandra and I talk all the time about how did the script get flipped so quickly between, they were calling grown A men like me in their late 50s boy up until the 1960s. And then all of a sudden they flipped the script and now you're scared of me. Black women have way more to be scared of against white men than any white woman ever has to be scared of a black man. And how the script got flipped is so outrageous. But I think that's what leads to when we talk about health disparities, because the value of our lives is not at the level where other people's are in terms of consideration in this country. Like I had mentioned before in one of the chats I sent out, we talk about Karen. Karen's just acted like her normal self. They have an expectation that when they come in to get A, they're going to get A. You even hear it when we talk about campaigns. We hope. We got hope. We got hope. Hope is defined as an expectation of things you don't see. Karen gonna get hers. I'm tired of hope. We need some more Karens. And we shouldn't be always stigmatized because we have to demand to be treated equal. When you're coming from here and you're being regarded as angry because you're simply trying to stop being treated here when you should be treated here, that ain't angry. That's expectation that everybody else has. But when they've lived under the paradigm of this on top of us for 155 years, they have to be educated. Why do we have to reconcile to them? They need to reconcile to us. I've never heard of the perpetrator having to telling somebody, it's like telling Charles Manson, yeah, I know you killed the LaBiancas and the Tates. You tell me how long you should be in jail. And we'll go. Okay, that's what they've been telling us for 156 years. It's time we start telling them, we'll determine when you've reconciled to us. Because quite frankly, I don't owe you anything, but you owe me everything.
Rashid, you need to have Peter on next time.
Hey, yes, ma'am. That's excellent.
Yeah.
That's excellent.
Yeah.
So,
I want to talk about a couple of the myths that people have regarding the vaccine. You want me to talk about that, or?
Yes, you can. Whatever information you have for us, we're going to take it.
Okay. All right. So one myth they were saying is the vaccine was developed too fast, and I don't think they know enough about it. And the debunk is, well, there's a lot of research done on the kind of viruses that COVID-19 before the virus even showed up. So people were working on research on the COVID vaccine before we had this pandemic. So scientists had a big start about the kind of virus that will work best to fight the virus. So the kind of vaccine that will work best. Another myth is only 1% of people who get COVID die of it. Won't the vaccine kill more people than that? And the answer to that is some people wonder if that could just be, some people wonder if that could be just because volunteers who took part in the vaccine trials were not tracked long enough for us to know if there would be deaths. It is true that we only have 3 months of experience watching people go through these vaccines, but we do have experience with other vaccines, and the vast majority of ill effects show up within hours or days. There is no basis for believing we will see something different here. Another myth, the vaccines can make you sick. The vaccines can make you sick with COVID-19. The current vaccines don't include the virus in any form. No live virus, no weakened virus, no dead virus. You cannot get the disease from the vaccine. Okay, there's a couple more myths. These vaccines use genetic material to fight the virus. That means they can affect your genes. These vaccines do use genetic material called mRNA, that stands for messenger RNA, to fight the virus, but it doesn't do anything to your genes. Okay. Another myth, they say that childhood vaccines can cause autism. Don't these vaccines contain dangerous chemicals that can have serious health effects? Not true on either count. Childhood vaccines are one of the best and safest protections against dangerous vaccines that have been developed, and these vaccines have been carefully tested for safety as well. Another myth, the vaccine contains a microchip that can be used to track my movements. So the vaccine does not contain any kind of tracking device whatsoever. The vaccine is being pushed on people against their will. Getting the vaccine is totally voluntary. Doctors and public health officials are trying to provide people with good information on the safety and effectiveness of these vaccines so they can make informed decisions when it's their turn to be offered the vaccine. No one is required to get the vaccine. You can't trust people with these vaccines. Big pharma, pharmaceuticals, the people who develop these vaccines are just out to make money and pay doctors to say their products are safe. While there's terrible examples of drug companies putting profit before safety, the process for developing these vaccines and the makeup of the products themselves has been transparent, with more information available to independent scientists than ever before. Another myth, Black and Latino communities are singled out to get the vaccine because it hasn't really been proven to be safe. There are certainly historical reasons for Black and Latino communities to fear being singled out. The concern is justified because people of color or marginalized groups have in the past been coerced and subjugated to participating in drug trials and medical procedures without informed consent, patient protections, or ethical practice. This is not the case here. However, Black and Latino communities have not been singled out to get the vaccine, but groups are being offered the vaccine based on the risk faced by the people in the group. So the answer is no to singling out, but yes, Black and Latino communities could be offered vaccines earlier than communities where infection, hospitalization, and death rates have not been as high. And you guys know that as far as COVID, it's mostly Latino and Black people. I mean, white people too, but you know, the majority. But you know what I know is being working in the health department for 30-some years, we're always the majority. With STDs, we're the majority. With diabetes, we're the majority. With high blood pressure, we're the majority. With high cholesterol, we're the majority. Now, I must say, many times people from the CDC, they do come in the Black and brown communities and do the testing and the trials there. So, of course, if you're going to the Black and brown communities only and doing the trials there, well, of course, you know, the numbers and the stats are going to be skewed to the Black and brown community because you're coming in our community and you're testing and you're checking. So I I always said, I think that the CDC should go to the Black and brown communities and do the testing and the trials and see, but they also should go to Santa Monica and Pomona and other places like that and do the same trials. And then let's see where we're at. No. And the last myth was, I don't need the vaccine if I've already had COVID-19. We do not know how long natural immunity, the immunity you get from having been sick, lasts. We also don't know if it is complete. There have been a few well-documented cases of people being infected twice. So even if you've had COVID-19 and recovered, you will benefit from the vaccine. So I thought this was kind of cool because it's you do hear a lot of people say these things. I know I do in the community. And a couple of things I've said myself, when the vaccines first came out, I was the ones who was saying, pharmaceutical companies, they just out to make money. They're making billions and billions of dollars on this, So, but like I said, it's a personal choice. And I think, if you don't take it, if you feel like, hey, what I'm doing works for me, my way of treating myself or taking care of myself works for me, then it's okay. So I really think it's just a personal choice. And I don't think, you're not gonna get any pressure for me to get the vaccine. It's just my story on why I want to do it. And was there anything else on COVID? No, I guess that's it, unless you have any more questions for me about it.
Okay, well, I'm gonna go around the panel.
Okay.
And, it's a few. I'm gonna start. We heard from a few people, so I'm gonna start with Brother Doctor because he was the first one here. So I'm gonna go with him. Brother
Yes,
Doctor, any question, any comment?
Oh, no, everything was informative. I agree with Sandra. You gotta definitely have Peter back on, man. You gotta definitely have Peter back on talk, but very informative, man. One thing is mentioned is, yeah, HIV. I haven't heard about that in a long time. So, is there a reason we're not that focused on that anymore? Because I heard your numbers. I didn't know the numbers were that high. I thought we were basically over that. Because with all the new drugs and everything, and I just read something today, they're waiting on the results of this COVID, the Pfizer kind of mRNA technology, because they're saying if this works, they're going to be able to cure HIV, everything in the future with this kind of new technology. But no, I'm shocked with the HIV. I haven't heard about that in ages. So that news to me.
The thing with HIV is since the medications come out and it's working, and people are not dying in the higher rates that they were before. They've made HIV manageable. You can manage it now. You don't have to, quote unquote, die from it. But what they don't tell us is that people still are dying from it. And they don't tell us the number of people who are still getting infected. And that's the thing that needs to still be discussed. And once again, the people who are highly getting infected are Black women. And it's still, and it's for several reasons. One, like the example I told you guys about the guy who had HIV and had his girlfriend, but he also had 7 male partners. You have men who still have sex with men, or who have had sex with men in the past, whether they might not even consider themselves gay. They may just be experimenting. They may have had sex with 10 women at a time and said, this bores me. Let me try something new. You never know. But whatever it is, the communication between relationships have fallen to the wayside as far as being honest about what you're doing and who you're doing it with. For example, a woman in my support group who met a guy. She was educated, master's degree. She was an engineer. He was doing well, Black man, had it going on, 6 figures. They get married, they vacation, and lo and behold, she finds out she has HIV. She's like, well, what the hell? How do I get HIV? Well, he gets tested, he finds out he has HIV. But then she finds out that in the past, he had a history of having sex with men. And in fact, as they was married, he was still sneaking around and having sex with men. So this is somebody, I mean, she had no idea. She didn't know. Another woman in my group who's a forensic chemist. I mean, she's phenomenal. She used to be a consultant on the TV show CSI. That's how bad she is. You know, she gets married, she gets pregnant. She has HIV, the baby has HIV. She's like, how the hell did I get HIV? Well, she got it from the man she married, you know, and she's like, well, what the hell? And you know, he confesses then that, well, you know, 5-6 years ago, I messed around with a guy, but I didn't think I would have it. I didn't know. So I remember going to a woman's house and telling her she had HIV, Black woman. And she said to me, well, there's no way in hell I can have HIV. You gotta be mistaken, Ms. Rogers. And I said, no, you know, I have your test results, and, you know, they're positive. And she's like, but there's no way I could have HIV because I've only had one partner and I know where my one partner has been. He's been in prison for the past 10 years and he just got out a year ago. So I know he ain't doing nothing in prison. Who he gonna score in prison? Ain't no women in prison. Okay. I said, okay. But you know, I'm like, you know what? I tell you what, where is he at right now? Let's go find him. Let me talk to him and let him come to the clinic and let him get HIV tested. He totally refused. No way. Not going, Ms. Rogers. Get off my porch. Don't be coming to my house and more telling my woman that she got HIV. I ain't coming to get tested. Don't come in. Yeah. Okay. But what I'm saying is the mentality of this woman is like, if your man is in prison, you know where he is. He's not having sex with no women in prison. Yeah. But did you ever think that in prison, maybe he didn't want to have sex in prison. It just happened. Maybe he was raped in prison. Maybe he was in prison for so long that he said, you know what, damn it, I got to do something. I mean, I don't know. But the fact of the matter is, men go to jail, HIV negative, and they come out of jail, HIV positive. And they're not going to go home to their Black wife or their Black baby mama and say, oh, this is what happened to me when I was in prison. These dudes got me in. Come on. They're not going to tell us that. So, you know, what I tell women now is who have men in prison, when they get out of prison, before you lay up with them, just say, hey, you know what? Can we go get tested? Now, there are a lot of women who will say, the man's going to get mad at me because he's going to be like, well, what you been doing when I've been in prison? You want to go get tested for what? I haven't been doing nothing, babe, but I just want to, I just think, Miss Rogers, this lady named Miss Rogers came to my house. It'd be best for us to just get checked before we do anything. I mean, so it's real. It's real. And like the 13-year-old girl said, the only time I hear I love you is when a man is on top of me. There are a lot of grown women who feel the same. Because in communities of disparity, you have women who know how to hustle, who know how to take care of their kids, who know how to work. But as far as being loved, as far as being held, as far as being, you don't get that. So, hey, if you get a man who, you live in the jungle or in Jordan Downs and your kid is getting beat up walking to school every day, and then you get a man who say, I'll take you out of Jordan Downs. I'll put your kid in private school, give you a Mercedes to drive and a nice house. But don't ask me who I be doing and what I be doing. You just, he could be having sex with me. But I know women who have had that lifestyle. They've married a man who have taken care of them. They're living well. They will never go back to Central and 80th. and they know their man's having sex with men, but they're willing to take the chance because they don't want their kid to go back to the school where they're being bullied, the school where they're not getting educated. They don't want to give up the Mercedes. They don't want to give up the house with the pool. There are women like that. In fact, there are women who, if a man straight up told them, look here, I'll take care of you, but I'm going to have sex with men and this is what I do. There are women who will, some women be okay with it. Well, I'm glad you told me. Now let me think. Can I deal with it? Yes, I can. So, there's a lot of different scenarios and of different things that you can go through. But the reason HIV is still very prominent and very high among women, but especially Black women, are for some reasons like these. It's the truth. It may be uncomfortable to hear it, but it's the truth. It's the truth.
Okay, Brother Hembrick. Brother Hembrick, question, comment?
Person, been knowing about it, and I know all of the reasons why, and that she mentioned, because I worked in the situation I used for 30-some years. I've heard all the different stories, not necessarily about the disease part, but use children.
We having a little problem hearing you, Brother Hembrick.
Can you hear me now?
That's good right there.
Mm-hmm.
Like I was saying, I've heard a lot of the stories, from kids, because I worked in the same situation as you my whole career. And I remember my first year teaching, I was trying to help this little girl with her math, and I'm looking over her shoulder, because I used to make them, show the work. And I look over her shoulder and she just jumping. I go, what's wrong with you? So it was a teacher there who had been one of my teachers. And, this girl used to love to go down to her room, so I let her go. And come to find out that the girl's mother had a boyfriend, and the boyfriend had abused the daughter, and the daughter told the mother, and the mother put her out the house. That kind of stuff.
Mm-hmm. Right.
All kind of crazy stuff that goes on, and our kids need a whole lot of help, especially mental health services. I've been saying that for years. That's what our kids need.
Yeah.
Anyway, very interesting stuff. I stay tuned in. I got in a little late trying to figure out all this technology out of this computer. Thank you, Brother Rob.
That's okay.
With your,
Glad to have you.
very interesting. Love the information that people need to know.
Yeah.
Right on, sister.
Thank you.
Okay, thanks, Brother Hembrick. Professor Amin Ra.
You're muted.
You gotta unmute. There you go.
There you go.
Appreciate what's been said, if I understand correctly. I just want to say I deeply appreciate you, Sandra, and you, Peter, for your information. And I think it really needs to be all over the internet, all over talk shows. I think you should be featured on talk shows, both of you. I think that your information is profound. I don't think it's a passion or anger. I think it's a love for your people and a love for your knowledge and your desire to try to save lives and to make life better for people. So that's a beautiful thing for both of y'all. And we deeply hope that as Rashkani put this on the YouTube, that we recommend people to get the tape or play the tape or share the tape on Facebook, because you came out with a lot of information. I have a few things I'd like to say. You know, I used to play a tape called Blacks with AIDS. BET put it out, and a lot of information that you say when the three areas that you were discussing. Mainly, I'll start with HIV. There are a lot of groups that are trying to address the racism in HIV for Black people. I Choose Life with Tony Wafer, as well as UCLA, and they have a whole department that's dealing with it, and a few other people in Atlanta and nationwide. But as you point out, you know, the sexual activity is one way, but the shooting of drugs is another way that HIV is shared. The other way is blood, at one time, blood transfusion. And the other one was hereditary. Because Arthur Ashe caught HIV through a blood transfusion.
Right.
And so, you know, you know, there's a lot of education that has to be done with regards to that. And I think that even though HIV is down in the white community, it's still high in the Black community as far as Black people not having the resources to get the medication that is working, and the discrimination in the disparity, whereas whites get all the money. They even get, as Dr. Karenga points out, they get money for, as HIV patients, you have people walk their dogs, and we can't get Black people medicine and things of this nature. So HIV is a very serious thing, but it's not just promiscuity and sex. It's that when you go to Baltimore, when you go to Washington, D.C., and you go to areas, especially rural areas where heroin is deep, men catch it, and then they go home and have sex, and they haven't had sex with another man, but they shared needles, and that's why they used to give out needles, things of this nature, to try to curb it. The other thing is, when you talk about disparity in health, there's a long history going all the way back to the Holocaust of enslavement, where they experimented on us with medicine and treatment, from amputations to see if they could sew an arm on and things of this nature, especially when our people got old and was not useful. The other thing is that through racial segregation, a lot of the times our mothers and fathers, we didn't have access to hospitals. So they came up with their own remedies, and we got comfortable with that. Put alcohol in it, or drink some 3-6s. We ain't got no money to go to the hospital. And they used to take people we used to have midwives that delivered babies, because hospitals wouldn't let our parents go in. And then second, it would cost so much that a lot of Black people in the 50s lost their homes behind having babies in the hospital. Now, in those days, they kept you in the hospital 3 days, 3 to 4 days, even if you didn't have no problem. Now you go home the same day.
Right.
In those days, and they was charging Black people, and that's why a lot of midwives were very important. But we got comfortable in our own treatment of each other. Take some aspirins and sit your butt down, and or go lay down or drink some, put alcohol. My father did even hot toddies.
Right. We still do hot toddies.
Yeah, all of that. That you cure yourself. In those things, especially if it wasn't an orthopedic issue or a big a serious gunshot wound or something like that. We generally treated ourselves when it came to illnesses. We got comfortable with it. The lack of trust comes from a long history of using whites using Blacks to convince us to get involved in experiments and projects for white experiments. Even the Tuskegee was in a Black college with a Black nurse heading it. You see, to recruit the men. So, we have a lot of mistrust, even when you had Black doctors and Black nurses, because many of them were working for white institutions that was using us and things of this nature. So that played a lot of it. But when it comes down to COVID, that's a whole new different ball game, because it's not a Black community or United States issue, it's a global issue. And when you have a global issue with multi-millions of people dying, and in Europe, that's predominantly white, and in other places, all over Europe and Russia and all of that, you can't just argue that it's designed to cut down on the population of Black people in Africa and in Black community. They're just trying to get rid of Black people, and they created it for that. So there's a lot of stuff that's going on out there, mythology, and especially conspiracy theories. I have kids in my family that won't take the shot. I told them, give me yours. I'll take the extra. If you're that blind that you don't just take the shot for you, you take it for your family. As Black men, we are protectors and providers of our families if you love them. And you don't take risks. You don't take risks. You don't experiment with drugs. You don't experiment with health if there's healthy. Then you have Black people that we said we would not take the shot, and as people we trust take it. And we've had people that we trust take it. Right. Second, we're gonna wait, and we waited. And we waited, I mean, people, when you see Obama take the shot, Michelle take the shot, and things of this nature, I mean, why would they kill all these essential workers? I mean, essential workers got to work. We're going to kill the police, the fire department, the people working in the mine. That don't even make sense. But I respect people that don't want to take the shot. Like I said, give me yours. I'll take 5 or 6 of them if it's, so I can get those 6 months stretch. But those are the disparities that we have. Religious issues. There are a lot of things that we have to deal with, but the fundamental thing is what you brought out, Sandra and Peter, is racism. Right. And, and they're doing in Africa and in Brazil and in poor countries that can't even get access to the vaccine or anything is criminal. But the point is that, we just have to fight for it. And I think that people like Holly Mitchell and people like Steve Bradford, them need to hear you. Hear both of y'all about, because when you have a high rate of HIV, you're gonna have a high rate of STDs. They come together. Right. And when you have the high rate of drug abuse and mental illness, as Brother Hembry just brought out, you're gonna have a lot of people taking advantage of young girls with mental issues and the incest and the stepdaddies and step uncles and cousins that are, raping and abusing the mentally ill and the young kids is off the chart. Things that Black people didn't do before. You see them doing things. They didn't took on a lot of white social diseases. Right. And so we have to get back into our culture. Culture of the best cure to any problem is the maintenance. I mean, the prevention. Right. So as you brought out about eating properly and nutritionally, we grow up and we're American by habits, but we got to get to be Black because we choose to and have a distinct cultural apparatus and mentality about just because we're in America, we don't have to be America. Right. We have to, I ain't saying don't get the social benefits and the things this nature, because as you brought out, you go to Kaiser now, and it's just like a county hospital because of healthcare now. People can go anywhere, and it's a 4-hour wait for urgent care, and you're in there with people coughing and sick. Unless you know how to go to a hospital, you can get, that's the worst place you want to go, But anyway, I just love the program. I really deeply appreciate the program. The only question I have is that, you know, are there any sense of, you know, because see, Martin Luther King Hospital was recently built. We used to have to go to Big General down on Soto Street. And then before there was Harvard General, before there was all these, and most hospitals in Black communities were there. They were for white people, and then when Black people moved in, the white people left. But the point is that, you know, the Watts Health Foundation, you know, we used to have mental health centers, Dr. Hiawatha and after the Watts Rebellion and all of that. So but in those movements, we have to begin to really put more of an emphasis on mental health and as you say, morbidities from the standpoint of that, and to cut down on the mortality. So I just know, are there any organizations and that you think are doing a good job, you know, any positive statistics out of any of these issues that you've raised that you think we can hold on to with a sense of not just hope, but of progress?
Well, I know House of Uhuru,
I remember them.
Yeah, and then they deal with some mental health issues and stuff as well. We connect with them a lot. But you know, there's this young man by the name of Jamil Lacey. He has this organization called Trap Medicine. He's out of Oakland, but right now he's in med school at Drew. Young guy, but he has Trap Medicine is an organization that they go to barbershops. So he goes to barbershops, meets with the barbers, ask, you know, can we do an outreach at the barbershop? So they set it up, and we'll come in and do the health education part. Because, you know, when it comes to barbershops, that's where Black men come together to talk, to, you know, enjoy each other's company and do that. So what we try to do is we try to go in and talk to the barbers and talk to the clients who's coming in and sitting and getting their hair cut. And we're doing education, and we have nurses coming doing glucose testing, blood pressure testing, weight, that kind of stuff, the HIV testing. And, you know, that seems to be a really positive thing that's going on. So there are things that are happening that people just don't know about. We need to get the word out more. I think, you know, COVID has kind of stopped a lot of the outreach that we were doing, but we want to get back into that. And but that's a good organization. I would love him, Rashiki, to come on and talk about Trap Medicine. I'll send you a video tomorrow of just a little snippet of that, of him and what he's doing. But he would be great to come on this type of program and discuss that.
There's a brother he's going around helping specifically Black people who have a home in the front yard to start an organic garden. I don't know if that was Joe that sent me that information, Henbrick, or somebody. They sent me, and it's really beautiful. And I just had a partner that made his transition. He was growing his food. We came up on farms out the South, and we grew our food. You wanted to eat, you go out in the yard and pick it, from the potatoes to the greens to the beans, and you shell peas and all that. But the point is that I'm saying, even growing chickens to eat, you know, I mean, instead of going to these places with all the hormone chickens. So the point that I'm trying to say is that we got to get back into health and nutrition and trust ourselves, and instead of just thinking that, you know, we can just go buy stuff from people that don't love us. That's all.
I agree.
Okay. Ms. Diane, you have a question, comment?
I have just a quick comment. I'm going to keep this very short because there was a plethora of information given tonight, and I got notes here. I got notes that I need to go through and digest, but I just want to thank you, Sandra, for being an advocate in our community. And you bring such passion, caring, and commitment to your occupation. And it's important for Black and Brown people to see someone that looks like us fighting for us. So I just want to say, you know, this is absolutely your life's work and calling, and we just salute you and celebrate you tonight. Thank you so much for providing all that information to us.
Thank you. I didn't pay her to do that, but she is family, y'all.
Okay. Well, she's speaking the truth. She's speaking the truth.
Yes,
I
absolutely.
appreciate that, Ms. Diane.
You're welcome.
Okay, Ms.
I
Lisa.
appreciate this, and I appreciate you, Rashiki, for even, you know, inviting me, Lisa telling you about me, and you know, it's really kind of motivated me too to maybe do a little bit more speaking out and getting things across.
Well, we could talk later about more things that can happen.
Okay.
Especially with your husband also. So we will we'll definitely speak again about doing some things.
Okay. All right.
So Lisa, question, comment.
Oh, the only thing I wanted to say was I couldn't hold them to myself. So I'm just so happy to be able to share these two. They've been my friends for really like triple digit years. And it's just really important to show and to showcase those people that we are a part of, who have been doing all this work in the community, and you know you've been a part of it. And this is a great forum for me to share their talents. And I'm glad you were able to put them on this. And so, you know, so we all can see. And the last thing I wanted to say was it's good to see Amin Ra. I'm actually a student of his back in 1980, I think it is. So I just wanted to thank you for the things that, I know I'm getting dark in here, I gotta turn the light on, but things you instill in me. I'm 56 years old now, and I was a bright-eyed student of yours when I was probably maybe 18, 19 years old. So
wow.
Just want to let you know that you influenced my life. I've never forgotten about you. So I appreciate the work that you've been able to instill in all of us. And I live in Sacramento now. Just to let you know, hey, your teachings are going all across the globe. So thank you.
Yeah, they are. Yeah, you know, everybody knows you, Amin Ra. I mean, I even know. Everybody. You know, either you hear about you, or, you know, there's this professor at Cal State Long Beach and he's doing this and that. I mean, you know, you always hear that. And you're a legend.
Yeah, I just have another quick question, Roscoe. What are the Black national organizations doing, like the Black nurses? There was the Imhotep Association of Black Doctors. They should be as passionate and as, you know, with these issues that affect us, you know, from that standpoint, instead of just having conferences. But I mean, I'm just saying, do you know, are they active? Peter, do you know anybody?
You know, a lot of these things, because of just the way things are, you know, whenever we do something, we have to make sure we include everybody instead of doing it for ourselves. So a lot of these organizations, they may start off, have a splinter group, but then they get melded in to the larger organization. So there's not a lot of those groups out there right now on the professional level. But, you know, one of the things I do think we need to do is we need to exploit some of these resources that are out here now, like the internet and the Facebooks and TikTok and whatever else, because we have a forum now that we can use. So I think it just behooves us to take advantage of it for, you know, getting our message out. And again, I would say flip that script back, you know, turn that record back over to side A, because it's been on side B too long.
All right.
Excellent. So, Brother Peter, do you have anything else to offer, or a question for your wife, or comment?
I don't know. I mean, my question is, you know, why are you with me? I mean, what's the point? You know.
You know why?
But I could say, you know, Sandra's been in the trenches ever since I've known her. when she talked about dealing with HIV and starting to group, I mean, this woman does not like to fly and went all the way to South Africa for the International AIDS Conference in 2000. So, and it was not a smooth flight. So this is somebody who puts their own comfort on the back burner because there's something bigger than her that she wants to accomplish. And it's a very difficult thing for most of us today to look past the hood of the car and look down the road. Most of us right now are just trying to get from stoplight to stoplight because of the way politically things are, because of the mentality that we've grown up with. We can't fix them. They need to fix themselves. But we need to work on the things that we need to work on and not stop taking they crumbs. Take the whole damn pie. Don't be afraid to take the whole damn cake and stop letting them brush the crumbs off, and we accept it because that creates a paradigm in them that it's okay. So that's the part that I want to educate us on is stop accepting the glass is half full. I want the whole damn glass because that's what I deserve. The 13th, 14th, and 15th Amendments, the Civil Rights Amendments that were done after the Civil War, out of those three, only the 13th Amendment has actually been implemented somewhat. Why do you need a Voting Rights Act when, as a citizen, 14th Amendment, I'm a citizen, I have a right to vote. Why I need a 15th Amendment for right to vote? We don't look back enough to say, this is mine. I don't have to ask you for it, and I ain't gotta be nice to get it. It's mine. But we've been so nice and polite and genteel for all these years that when we do raise up, and like Sandra says, she's the angry Black woman. No, she's not. She ain't the angry Black woman. What they are is the over paradigm, the over privileged, and don't realize that they've been riding off the credit of us for the last 156 years. And quite frankly, I've heard two phrases, and I'm gonna be quiet. There were two phrases I heard about 30 years ago about the United States, and they are ringing true. The first one was the third world is tired of financing a lifestyle that the first world cannot afford on its own. And the other one was just because the United States lives the way it does, nobody said you're entitled to live that way forever. All great societies that cannot be conquered from the outside crumble from within. And we've seen that from the last 4 years, that orange nightmare we finally got out. So, you know, this is the time, you know, we need to step on the gas and we need to educate ourselves, but educate ourselves the right way. There ain't nothing wrong with us. We're responding to the pressure that's been put on us. So when we talk about the promiscuity, we talk about the drugs, high blood pressure. You'd have high blood pressure too if you had to watch where you was walking every time you went outside the house. You know, me and Sandra live by Culver City. I go around that sucker because I know who works there. So that's all I got. This, you know, I'm in the other room right now because I don't know what I'd be doing if I was standing in the room next to her. Popping off.
Okay, well, look, this has been like so good. I don't know what to say. This has been wonderful, and I appreciate Sandra. I appreciate Peter, Professor Amarat, Diane, Lisa, Brother Hembrick, and Brother Doctor. I mean, this has been excellent. And next week we have a different day. I'm not able to do Wednesdays for the next 5 weeks. So we're going to be on the 22nd, and Brother Hembrick is coming back with Know Thyself Part 2. So it should be very interesting. Everybody's
What
always
day is it
welcome.
going to be on?
It's going to be Thursday, the 22nd, and it's going to be on the website. And you'll be able to come right on in like usual. And so it's next Thursday, April 22nd at 6 o'clock.
Okay.
I'm not able to do Wednesdays for the next 5 weeks unless something changes, and I'll keep everybody informed. So each one teach one, folks, and we will do this again.
Okay. And like
Thanks
I said,
a million. Everybody have a good evening.
Okay, you too. Take care.